All right, so development in the first year. We first want to think about developmental milestones, and you will be responsible throughout the ages and stages of the lifespan of being able to identify and point out some of these developmental milestones. Now, if you look in your textbooks, there are charts and charts and charts of developmental milestones, and it can get a little overwhelming. But you want to keep in mind some of the big milestones throughout childhood and, in fact, throughout adulthood that we use to measure ages and stages of development. So, in the first year for infants, the sequence of milestones is used to assess infants, and if they don't fall within a normative range, we will label them with a developmental delay. The delay may be global, meaning it encompasses all areas of their life, or it may be focal, in other words, encompassing just one area of their life. For example, they may have a feeding difficulty, or they may have a motor difficulty, or you get the idea, right? So global or focal, and it's important to differentiate. In the first year of life, there is a huge amount of growth. It's really quite remarkable. Length of the child increases by 50%. Birth weight doubles by 6 months and triples by 12 months. So that's huge. If you're born and you weigh 9 pounds, you weigh 18 pounds by 6 months, and you weigh 27 pounds by 12 months. Huge growth. And then the growth rate slows in the second half of the first year. So we want to keep that in mind just as we start looking at the different domains of development. All right, so when an infant is born and becomes a neonate, there's processes that occur within all systems, and I've just highlighted a few of them. For example, the cardiopulmonary system. So in utero, the lungs are not necessary to provide oxygen. As soon as that baby is born, the lungs must sustain breathing, right? And so when the baby is in utero, fetal circulation bypasses the lungs, and suddenly the lungs are needed to filter the blood to engage in respiration, and they are late to develop. So with kids who are premature, it's a very common cause of complication. Because of the slow development of the lungs and the fact that the lungs are not fully developed until near term. And term typically we consider 40 weeks, and 38 to 40 weeks being within that very kind of normal period. Another example would be the digestive system. Newborns may experience a temporary increase in bilirubin, and that is due to the liver not yet being fully functional. And bilirubin leads to a yellow cast in the red blood cells, and so children will have a yellow cast to their eyes and their skin. It's typically if a child is premature before 38 weeks, and in some breastfed infants. Typically, there's some pretty simple ways to get rid of the jaundice, which is the name for what happens when there's bilirubin buildup in the red blood cells. The mom and the baby eating more, and then ridding the body of bilirubin through eliminating. Also, phototherapy is commonly used, and the way that this happens is that the baby just has little patches over their eyes and is not wearing much else, and the light changes the shape and the structure of the bilirubin molecules so that they can be excreted in both urine and stool. So that's a very common kind of treatment for jaundice. And then in rare cases where the jaundice is more serious, blood transfusions will happen, and they occur in the neonatal ICU. So these are just two examples, cardiopulmonary and digestive. But when the baby is in those first periods, changes are happening across body functions. They're also happening across body structures. So the central nervous system and motor function is kicking into gear, and we'll see as we move through the presentation that a ton of changes are going to happen in terms of body structures and the ability of the baby to function. Early motor behaviors are processed primarily at the spinal cord and brainstem levels. So when you think about it, they're happening more at the survival levels of the nervous system. And as the child matures, we see more cortical kinds of things happening, as well as limbic system and midbrain kinds of development. Another thing that we see in another area of development is neonatal reflexes. So a reflex is a stereotypic obligatory response to stimulus. What this means is that it is a motor response, but it's not voluntary. So the baby is compelled to respond in a certain way. Neonatal reflexes are typically considered like the building blocks of motor behavior. So first you have this involuntary response, and then as the child develops, they develop voluntary response, and those voluntary responses build on what the reflex patterning has provided them. They dominate a newborn's behavior, and the patterns must be integrated to permit more complex and mature neuromotor patterns. So residual reflexes, which happen when children have a neurological insult or a neurological delay, need to be integrated so that the child can act in more sophisticated kinds of motor patterns. We think about a variety of different kinds of neonatal reflexes. Oral motor reflexes, the most common would be the suck-swallow, phasic bite, gag, and rooting. So just for example, rooting is the nipple touches the baby on the side of the face, and the baby turns to it to initiate feeding, right? So we have oral motor reflexes, we have postural reflexes, and there are a number of these, and they are the building blocks, once again, of more voluntary and higher level kinds of motoric function. And there's a YouTube playlist, and this as well as many other resources are listed in the presenter notes section of the slide decks. So please do reference the slide decks themselves, and you can see videos on reflexes in general, and then we're going to watch and discuss a variety of reflexes in class. We'll do some observation after watching videos. So we'll return to this topic when we see each other in class. All right, sleep patterns. So a newborn sleeps 8 to 9 hours per day and 8 hours at night. That is a lot of sleep. Because a baby has such a small stomach, they have to wake every 3 to 4 hours max to feed. So sleeping through the night doesn't start until at the earliest about 3 months of age. Sleep phases, there are asleep, which is pretty clear. There's quiet alert, so the baby is awake, but they are calm, and there's crying. By 6 months of age, nighttime feedings are typically not necessary, and infants may sleep through the night, which the night is comprised of 9 to 12 hours. Infants nap from 30 minutes to 2 hours 1 to 4 times a day. So again, a lot of sleep to support a lot of development. Infants develop self-soothing behaviors so they can help calm themselves down when they're in those transition periods between wake and sleep and before going to sleep. And secure attachment, so again we have this idea of attachment, assists with sleeping as well.